Welcome to Tagge Precision Health. I'm Dr. Daniel Tagge, a family physician, certified health optimization medicine practitioner, and a medical acupuncturist. I want to talk a little bit about my clinical practice in delivering a standard of care for health, not disease. We have a definition of health, which we'll dive into in this video. We have a method for optimizing health, and we have a framework that's built on 7 pillars. The 7 pillars are metabolomics, evolutionary medicine, chronobiology, exposomics, mitochondrial bioenergetics, the gut immune system, and epigenetics. This framework is exclusively designed for a standard of care for health, not disease. Thanks for being here, and I look forward to talking with you. If we're going to talk about delivering a standard of care for health, not disease, we better start off with a definition for health. This video is going to dive into our definition of health at Tagge Precision Health and Health Optimization Medicine. Everything that you talk about, you should consider defining that thing in your mind first, or else you're at risk for problems. The precision of your language determines a lot in terms of your psychology and your physiology, as well as your communication. So everything depends on your definition of that thing, whether we're talking about stuff that we measure, whether we're talking about success, whether we're talking about optimizing health, or whether we're talking about diagnosing disease. All of it depends upon what we define as certain things. And if we do not agree on what health means, we cannot meaningfully discuss how we should measure it, optimize it, or whether any specific patient actually has it. So that's our starting place. Health is currently considered in the conventional system as the absence of diagnosed disease. And this is somewhat implicit when practitioners work with patients. You see, when blood pressure is not elevated, people assume healthy. When A1C does not meet threshold criteria for diabetes, people assume metabolically well. When the imaging shows no malignancy, people assume healthy. You see how the health in the current system is an assumption when there is not disease? And this is a categorical error because we're not actually defining or measuring health. We're simply saying that health is just the absence of disease. Absence of the disease is one piece of the definition, but it is not the entire definition. Health is, in our framework pioneered by Ted Achacoso, defined through a math equation, a simple equation of A plus B plus C. This is something that at some point in time could be mathematically modeled by very smart people, but it also can be simply stated. So health is an optimal physiologic state characterized by the absence of disease, see that term there, as well as, this is where we're different than conventional and functional approaches to medicine, the balance, A, the absence of disease, plus B, the balance of anabolic and catabolic pathways in the body, that's your metabolism, according to C, where you're at in the life cycle. Let's dive into each of those terms individually. We already talked about the absence of disease. We discussed that the conventional condition is that it is somewhat necessary to meet a definition of health to not have disease, but it is not sufficient in and of itself. The other thing that I would note here is just because you have a disease does not necessarily mean you can't be healthier. So it is not, we don't want to think about health as a binary state, yes or no. We want to think about it as a spectrum. Where are we at on the spectrum? And if we have, for some reason, a disease, still the answer is, what can we do to be healthier? Not, oh, we have a disease, we can never be healthy. So you cannot determine what's optimally healthy while active disease is present. This is somewhat true, but the conventional definition is wrong and incomplete. It is just one of 3 variables and not the whole picture. So moving on to that second term, health equals A plus B plus C, the balance of metabolism. Metabolism defined as the sum total of reactions in the cell. We have the balance of anabolic processes and catabolic processes in the body. That's building work and breaking down work. Anabolic pathways are the ones that are building you up, and catabolic pathways are the ones that are building you down. And the correct ratio between these pathways, and this is where the modeling comes in, is what good medicine is. See, we're searching for health as an optimal physiologic state, and medicine is the thing that gets us, that detects the difference from that state and where we are and gets us back to that place. And then the definition of healing is actually the process or the slope of change of what's going on. So most chronic disease is a failure of this balance. The body locks into building mode, anabolic, inflammatory state. Repair never properly runs, and lots of symptoms. This is what imbalance looks like when the B term is not in balance. Here's an image that shows some of the balance of catabolic pathways and anabolic pathways. The catabolic pathways here are the ones that break down our macronutrients like carbs, fats, and proteins into simpler building blocks. These are shuttled mostly to the central hub of our system, the mitochondria, which is responsible for a whole lot of synthetic function as well as generating energy. And the anabolic side are the building up processes of building protein, building muscle, building fat stored, energy storage, is building cholesterol and membranes and DNA and reproducing. You see that at the bottom here, there are hormonal signals that are governing both of these sides. On the anabolic side, you would have things like growth hormone, insulin, and others. And on the catabolic side, you have your catecholamines, as well as other ones. And so this is the dynamic balance that we are in with cellular health. The last term that we want to dive into is according to C, the life cycle. And this is an important one because optimal should be characterized and personalized to the individual at where they're at on the spectrum. Obviously, you would expect a baby to be very different than an adult or a geriatric patient. And so through this term is how we can actually assess the anabolic catabolic balance for the age of the individual person that we're evaluating. So whether he's a 25-year-old or an 80-year-old, the terms of the equation do not change, simply the targets within them do. And the reference standard moves across the life cycle. So static definitions don't work well. Term C here in our definition of health is what allows us to apply the same principles but have a personalized approach depending upon where someone is on that spectrum. So our definition in total is A, the absence of disease, plus B, the balance of anabolic and catabolic pathways in the body, metabolism, according to C, where you're at in the life cycle. One equation, the foundation of a standard of care for health, not disease, is actually defining health. And when I came across this information, it was so obvious to me that this was the future path that we needed to follow. Someone actually setting a definition for health and developing a standard of care around measuring and optimizing health, that I decided to leave my clinical practice in conventional medicine and build my own practice focused on delivering a standard of care for health, not disease. Thanks for watching. Tune in for more. Tagge Precision Health, Charlotte, North Carolina. Talk soon.